Flood victims in Awade Kome in the Central Tongue District are heaving a sigh of relief after a visit by the Ghana Pharmaceutical Society. The society and the Director General of Health of the Ghana Health Service, Dr. Patrick Kumabwaje, who toured some of the affected communities in Kanus, observed the extent of devastation caused by the Akosombo Dam spillage. The over 200 residents received relief items and medical supplies worth 100,000 Ghana cedis and promised conducting free medical care for affected persons. Ivy Setoji has more.
The Ghana Pharmaceutical Society, led by the regional branch, who toured some of the affected communities in Canoes, apart from the Abadiwe Kome in the Central Tongue District, noticed how devastating the flood was in the area, which made life very difficult for the residents. Members of the Pharmaceutical Society realized the entire community of Abadiwe Kome completely submerged in the water, leaving the community as a ghost town and making the over 1,002 residents homeless. The national president of the society, Dr. Samuel Kodonko, who led the team, has been speaking with JoyNews.
We are here now at Central Tongue, in precisely a town called Abadiwe Kome, where we've seen the displaced island, or people who have been displaced from an island. It's been an eye-opening experience. You hear reports, you read about them, but being here, seeing it live, a complete house submerged, that's right on my left side. I mean, this is very serious. We are now currently maybe on the farmland, and the farms are completely gone. So you can see the complete livelihood of people gone, just like that. It's really a sad story. I mean, being an eyewitness to it, I would say it's really a sad story. All I would say is that we have to do more to prevent such situations. Yes, we will put in the relief items, we will help those who are displaced, but we need to have long-term solutions to this. I would also want to say, as a country, we need to really have an emergency relief fund that would always be sitting down. In times of needs like this, we need to fall on the emergency relief funds. Something that will not be so difficult for us to fall on, because these funds should be funds that probably are ring-fenced for such a purpose. We've just gone through a pandemic which was also had a major impact on the country and the economy, which was COVID. And we are having floods in some part of the countries. All these put together, Pharmaceutical Society of Ghana has already recommended that the country should have an emergency relief and public health fund set aside, purposely to deal with such disasters.
Alex Gabi Hotoje is the MP for Central Tongue.
This is our document for you, and it's part of my constituency. It's an island, it's wholly surrounded by water, and within it you still have creeks. This is what you see. You see these houses. That is the house of the assembly member, and with the water here, there are even reptiles like snake. So if you don't take time, you can easily be bitten by a snake. My fear too is that this morning it rained cat and dog. So apart from the man-made situation, which brought about the flood, the natural element is also rearing its ugly head. And this one we pray to God to save us.
The Dufia of the Bakpa Abadiwe Kome, Togbi Sakpiti V, is appealing to government to equip NADMU so they can be able to bring enough relief items to the affected communities.
I was able to organize some few boats to do the evacuation. And we are safe here now. We have a lot of concerns, we have a lot of problems that we need to solve as individuals, and we have a lot of problems to solve as a country. So I'm asking for a lot of help, support from individuals, philanthropists, and corporate organizations. Currently, our school is no more in session. The students are in the house. They have to go to school. But on that fateful day of evacuation, I did not see anything from NADMO. So I'm asking the government to equip NADMO so that they can act. They can have their emergency team beef up. I have to raise my own resources with my assembly member to do a whole lot of things. And you can see, taking care of about 1,200 people it's not a child play. The last time the vice president was here, the assistant director general of NADMO lied that he was able to evacuate the people, which he didn't. Not even a single life jacket was given. I wanted to meet that young man one-on-one on TV or anywhere. The way he was able to do the evacuation, he should tell us. My people know that I am the one with the assembly member who do the evacuation with the help of other chiefs and citizens. So I don't know why he will be lying to the whole, the general public that they were able to resource, do the evacuation and other things.
The Director General of Health Services, Dr. Patrick Kuma Abuadi, who also toured the area, pledged to make sure that affected residents of the flood are provided psychological support and adequate health care to make sure that they are able to pull through the traumatic experience of the flood.
We know that there have been psychological trauma, and so we have also engaged our psychological society, and I believe that this week they will also be here with their mental health team to ensure that they provide you the necessary psychological support as the October requested.
The Pharmaceutical Society has however donated hundreds of medical supplies worth 100,000 Ghana cedis and relief items to all the communities in the Central Tongue district and promises to mobilize more for the affected districts. Ivy Satoji, JoyNews, Abaduwe Kome.